Welcome to Living Chronic, the podcast that explores the realities of living with chronic illness and disability while redefining how we thrive in our personal and professional lives. I'm your host, Brandy Shantz, a disabled veteran and chronic illness warrior, here to discuss the challenges, triumphs, and untapped potential of life with a chronic condition. Before we dive in, please take a minute to hit the subscribe button on whatever platform you're listening. Now, let's change the way we think about disability together. Hi, this is Brandy Shantz, and you're listening to Living Chronic. Today I'm here with Ashley Hirsch. She is a registered dietitian. She owns the Crohn's Colitis Dietitians. She's also a podcast host of the show Gut Feelings. Welcome to the show, Ashley.
Thank you, Brandy. It's good to be here.
I'm really excited that you're here. I really love what you're doing. We had a conversation. I told you I just love the way you address the logging of food. I know so many of us are out there driving ourselves nuts with journals all over the place of every little thing we've ingested over the last 20 years. Having a real professional who does this and understands, say, stop is warming to my heart, to say the least. So tell me a little bit about the Crohn's Colitis Dietitians. How did you get this started, and what do you guys do?
Yeah, so I've been in private practice for over a decade, and I used to see kind of more broadly, lots of GI conditions, autoimmune diseases, and I always found myself drawn to Crohn's and ulcerative colitis, just given my own journey with it. And I was connected with people that had it because I know so deeply how much we're often left behind, not given support, not
Hmm.
given any sort of guidance around nutrition, especially because if you ask your doctor, what do I do? You're generally told it doesn't matter. But what I was experiencing as a patient was, oh, it does matter. It
Hmm.
definitely matters when I can't eat. It definitely matters when I'm malnourished. It matters when I'm in pain. Like all of those things really matter. And I think that's what it feels like when they say that feels like, well, I don't matter then
Right.
because my life is chaotic because of this diagnosis. And so I always felt really drawn to working with people with IBD, but I kept it sort of hidden for most of the beginning part of my diagnosis. It was a combination of just like
Hmm.
of fear and also not wanting, ironically, not wanting to be known for having it, not wanting to
Right.
even accept that I had it. And it wasn't until my cousin was diagnosed and came out to me and told me like, "Hey, I'm really struggling and I know you have it and I want to talk about it." And we started connecting on that level, and I saw him using his diagnosis as a way of coping, as a way of connecting with others, and it really inspired me to be more vocal about my own journey. And the more that I opened up, the more that I saw how much it actually helped other people to know that they're not alone and to know, like, hey, you get it. I don't have to explain that part,
Right.
because you go to doctor's offices all the time and you have to explain yourself on so many levels to someone who doesn't understand.
Hmm.
There's so many that don't understand what we go through. And so when I saw him doing that, it inspired me. And sadly, in 2018, he passed away, and he was a real close, like a best friend to me
Oh.
for the first part of my diagnosis. And with that loss, it just really turned the corner for me. It gave me something, it changed my trajectory quite a bit because I saw what he went through and I saw how he was kind of stuck in this place of living with a gut issue, but crossing over into like disordered eating and that being complicated with stuff online that you're reading and in it making you take this turn of like one trying to do it all on your own, two getting misdirection from people online,
Hmm.
and not being in either camp of eating disorder or gut disorder because he was
Right.
kind of with IBD, so 80% of us have disordered eating.
Mhm.
1 in 4 will have an actual eating disorder, but it is very different than the standard eating disorders that we see. It's called ARFID, avoidant restrictive intake disorder, and essentially it's not the difference is that it's not related to body dysmorphia or any kind of restriction from that. It's mostly restriction based on food is painful, my
Right.
gut condition's painful. You start to kind of have a little bit of PTSD with food
Mhm.
when you have a gut disorder. And so what I witnessed with going on that journey with him, really it left a mark. Like I could not say things anymore. I could not speak up about my own diagnosis. Not long after I lost him, I kind of went through my own journey of being in the hospital and being, you know, thrown in like the tide of
Mhm.
chaos with, when you're dealing with a lot of unknowns and having being undertreated for years and just not having support. So I
Mhm.
experienced my own journey of like getting lost in that chaos and it really inspired me to connect on a deeper level with people and to really, support other people with IBD, to invest in putting together more research around nutrition and
Mhm.
IBD and just kind of dedicate my career to providing solutions for people and providing some kind of support that we're just not getting in the healthcare system right now.
No, absolutely. It's so important. It's appreciated that you're doing this. It's so important because as I said, it's so lonely being a sick person sometimes. It's so lonely. And something that every sick person recognizes, and many healthy people that just have no idea what this is that person coming up to you and saying, "You just need to go gluten free." That's it. You just need to, oh, you're probably eating processed foods or sugars or whatever it is that they've read about. And part that does influence how you're eating too, because of course, you're not seeing 7 different doctors because you just didn't go gluten free. And if it were that easy, heck, my life would be wonderful. So having a real professional there to, just kind of stop the insanity and say, no, let's talk IBD and nutrition is so, so important. So you actually have this great business where you're helping people one on one and helping them to get to where they need to be. So how do you usually start with somebody? Say it's somebody like me who's, you know, sometimes I just feel there's nothing in the world that can possibly help my Crohn's disease because everything seems to hurt. Where do you usually start with someone?
Well, in our practice, that looks like a lot of listening, a
Mhm.
lot of asking questions, digging deeper. And you're not just listening for what people are telling you about what they're eating and their journey and their history, but you're kind of also trying to assess where are they at in this? Like, how do they feel about all this? Where are they at in the journey? What are they ready for? What are they not? What's in, and also the bigger question is like, what's the most crucial thing that we could help them with that will turn the corner? Because a lot of times, like, let's say we have somebody who has is maybe barely eating, or maybe they're eating maybe all they can tolerate is like one or two foods, and maybe
Mhm.
not they're not the best foods, but and they're not sleeping at night and because they're going to the bathroom, or so we kind of
Mhm.
have to narrow down what's the most important thing that we can do right now, because there's a lot of things that you can help somebody with, and you kind of do have to prioritize. Okay, number one is sleep. We need to make sure that they're sleeping, so how can we reduce their symptoms at
Yes.
night so
Mhm.
they can sleep through the night? Because if they can sleep through the night, their mood's going to be a little bit better, they're going to be more motivated to do any sort of change. And number two, making sure they're getting enough.
Right.
That's sometimes those crucial foundational things are the starting point. I think a lot of times people come in with, okay, what do I eat? What's the answer to that question? How can I navigate this? But what we really need to see is, what does that path look like for you
Mhm.
specifically? Because it does look different for everybody. There's just, with IBD, there's so many different things to look at and help someone with malnourishment being a key feature and being low nutrients and often having a complicated relationship with food. So it's
Hmm.
kind of all about prioritizing, asking questions, and really getting to know what's important to the person.
Hmm. Thank you for that. It is difficult. It is very difficult as a sick person to, I think, get down to the what's important, and having somebody to
Mhm.
help you with that is everything. I can't tell you how many times in my life I felt chaos all around, and I just can't figure out how to put one foot in front of the other because it's just too much. How do I pick my foot up? I don't even know right now. There's just too much coming at me. And I think a lot of people get that way. And I think one of the things we hear most often is go on a liquid diet. My doctor tells me that all the time. Do liquid.
Mm.
Liquid works. And I hate liquid. What's your viewpoint on the like? I mean, if it's an all wine diet, I fully admit I'm like, who wine? I really hate how bad wine is for me because I love it so much. But the actual diet they want me to go on, I think, no, not so good. So what's your viewpoint on the liquid diet?
So I guess I'm not clear on which diet they're talking. There's some diets that will go like CDED, I think may have a component of that, or like a elemental diet. Is that
Hmm.
what you mean? Kind of elemental.
Yes, yeah.
So with elemental, you are still getting like complete meals, but they're in liquid form.
Hmm.
Is But I think a lot of people interpret liquid diet as a whole as just liquids like orange juice or something like
Right.
that.
Hmm.
So to be clear, I guess we're talking about elemental um using like broken down carbohydrates, fat, protein,
Hmm.
all in like a smoothie form sort of
Right.
thing. I mean, I think there's probably a time and place for a lot of different type of dietary approaches. Generally, what I found is people are usually already so restricted that our
Hmm.
biggest goal is to try and help them expand a little bit. So
Right.
the the core aspect of liquid that is helpful is that you know any kind of what we know about IBD is that any kind of broken down anything, whether that be like reducing particle size, like butter versus almonds, or smoothies and soups and all of that, we do know that that kind of format tends to go better from a symptom standpoint. People tend to have less symptom response that route, and there's like early evidence of could there be more to that story other
Hmm.
than just it helping with symptom relief. But it's you generally not my starting point for a lot of people, because the people we get are generally so malnourished already that
Hmm.
we'll incorporate elements of that and encourage them to do like blended formats of thing, more smoothies, more soups. But the idea being, how can we advance the diet in a
Hmm.
in a way that expands it and opens it up to more foods? Because we do know that diversity is key to a better microbiome, higher chance of remission, especially deep remission, if we can encourage more of those
Hmm.
diverse food aspects. So, yeah, that's generally the goal with most of the people we see.
So what is your I guess, goal with people who do have anxiety around foods? Because I think a lot of people hear that and they think, oh gosh, that's so overstated. PTSD from food, it's not a war, but it very much is a war for many of us. And when you have eaten something and it has given you such pain, you remember that and it does create an anxiety. So many of us, if you say, something like, if you say to me, like sometimes my husband, when we're out with a group, will try to sneak in at dinner something silly like a steak roll. And I'm like, you've got to be crazy, man. I am not touching a steak roll. It's not happening. But when you say to me something like that with a fried and it probably has been frozen and definitely processed, my mind goes terrible, terrible places. And of course, that's probably not the worst thing to have a bad reaction to, but for so many people, it's a large number of things: carrots, lettuce. Every time you have a something with dairy in it, and it starts to become bigger and bigger and bigger. So how do you approach that kind of anxiety and trauma, because it's very real?
Yeah, and I think there's a fair amount of people that don't actually know that they're experiencing fear too,
Mm.
because you can also have, with traumatic experiences with food, and we do all like people with IBD do have trauma with food often. Not
Hmm.
everybody, but if you've had strictures, if you've had obstructions,
Hmm.
though, you're definitely you're definitely in that camp where you're at high risk for having trauma with food because it can feel like that food caused it even when it's an anatomical thing,
Right.
but it can feel like, well, that popcorn or whatever it is. But I would say there's a lot of people too that are in the camp of they don't actually know that they have fear. They just know that they're avoiding it. It causes symptoms, and to complicate that, the fear of it can be its own trigger. Like you can be TSA line can be a trigger for me when I'm at trying to going on a flight.
Hmm.
Knowing there's not a bathroom around, I can be in a good place with my IBD, but it can still trigger me because of
Hmm.
those memories. So it's food, it's other triggers too. But how we usually navigate that is through, I would say, first figuring out like, okay, what's most important, what's not, and clarifying the impact of a trigger. So a
Hmm.
symptom trigger is going to be different than an inflammatory trigger or something that we know puts you at more risk for flare up. And in those inflammatory triggers that we know put people at risk, having them one time isn't going to put you in a flare or cause inflammation, but it's more so having those in a consistent pattern over time that can. And while the symptom category would be more things like, let's say, leafy greens sometimes, or nuts, or things that trigger symptoms for people,
Hmm.
but they might actually be good for the IPD. And so it can be kind of nuanced into uncovering what those things are. And you can have overlap too. You can have something that both trigger symptoms and is one in that inflammatory category. But yeah, I think the first part is like unpacking what triggers are, all the different types of triggers, and kind of helping people explore that for themselves too, and
Hmm.
really understanding what kind of trigger they're dealing with. And I think having that kind of information is key to unraveling other stuff they've read online. And because it's complicated, because we're hearing lots of different things from lots of different people, and really unpacking where is the truth within all of that we can
Right.
understand better.
That's the interesting thing about the internet, the interesting thing about social media. I always say to
Yeah.
people, there's somewhere in everything at least one nugget of truth. At the very
Yeah.
least, there's one nugget of truth in everything, but finding it, that's the difficulty. And understanding that I don't know is a perfectly okay phrase, and understanding that we're all different and everything reacts differently. But when you first start, it's very overwhelming because everybody has something to say and you just don't know where to start with it all. It's so difficult to figure out.
Yeah, and like what you said, it is. It's very uncomfortable. I think it's important to acknowledge too that it's uncomfortable for people to not know something, to
Hmm.
be in the gray area.
Yeah.
And so we feel a lot of comfort in knowing this is the truth. And so
Hmm.
that's why we tend to be more black and white around things. And when you're reading online, you tend to see more black and white things. And,
Hmm.
a blog isn't going to be interesting if it's like very much in the gray area and you're like, well, we don't know about gluten.
I,
No one, people would want to know, like, is it helpful or is it not? We don't want to explore the nuance as much. And I think that it's an uncomfortable thing to sit with, but sometimes, yeah, you're right. I don't know is is sometimes the answer.
it's so unfortunate because you're right. It's not interesting. It's not comfortable. It doesn't feel good. But unfortunately, it's just the truth. It's just the truth. And we can find some things that might be true or could be something close. I think that has been the hardest part of being a chronically ill person for me. Learning
Yeah.
that I don't know is a very important phrase, and I need to figure out how to be comfortable with that.
Mm.
It's hard.
Yeah, and I think, being somebody who reads a lot of research and has created my own research studies, the more that you go down that path of getting in that world, the more gray you become about things, the
Hmm.
more that you see, oh, there's a whole lot more to the conversation than's being, and usually media is the opposite. You're
Yes.
not going to see a lot of gray area. So I think that is important to think when you go into reading any article is really understanding that when it comes to like nutrition science and science in general,
Hmm.
it's a lot of gray area. It's a lot of like
Tons.
understanding new things all the time.
Tons. It's interesting because I've thought a lot about, because I do not have a science background. I'm not even science adjacent. I think I took an exercise science course in college because, well, I loved it. So why not? But finance, I know. And one of the most interesting things I ever learned from one of my finance professors was the absolute best guys on Wall Street. I mean, the guys who are killing it, the guys who everybody wants, the ones who make all the money, they're right 50% of the time. And I thought,
Wow.
well, that's nuts. And then, of course, I went on in life and I'm like, yep, nope, that is spot on. And nobody ever hears a finance person on YouTube saying, I have a 90%, bad feeling about this. It's always like, I know this, I know that. It's never, this 40% maybe. And, everybody's confident. But it's really the best guys are right 50% of the time. And becoming ill and starting to read all this research, it really made me think, it's very similar, if not even more so, because, I think as a Gen X person, I've watched science come so far just in my lifetime. And of course, 50 years leading up to my birth, we made so much progress. So, we've been in 100 years of so much progress that it almost seems unreal that people, didn't know what we do, 75 years ago. But when you put that in context, in another 100 years, people are going to maybe they'll come across this podcast and think, oh, you didn't know that XYZ is true? Wow. But
Mhm.
but that's just how science works. You don't know what you don't know until you learn it. And then you're going to learn something new later. And I think that helped me to place a little bit of it in my head. I thought, well, you know what? We can't all predict the subprime market bust, but we also can't know exactly what's causing my Crohn's disease right now, and that's just going to have to be fine. So it's a
Yeah, and that's the beauty of it too, is that with research and science is that it all builds on each other.
hmm
And I think something kind of encouraging that I've gotten to see in my journey so far is just actually like how we are making progress with that research. We are getting closer to answers than we ever have.
hmm
There's more treatments. I think a lot of times when we talk about research, it's always focused on the cure or the solution,
yes.
but we often miss like how profound everything else is. Like
hmm
profoundness meaning there's a lot of breaking ground into uncovering like new treatments that are more targeted and less severe. We've made a
hmm
lot of progress there. There's been light it's light years different than it was 20 years ago with our knowledge around what's most important when it comes to nutrition for IBD and how important that is as an adjacent, kind of approach. So I think it's come really far, and there's so many people that are invested in helping people like us. So I think that's
hmm
also a beautiful thing.
It really is. I always love to say, it's one of my favorite sayings: "Perfection is the enemy of progress."
Mm.
So, it's fine. We haven't cured it yet. Okay, but look where we've come.
Yeah,
Uh, I,
truly.
yeah, in another world, I would possibly be dead by now. So,
Mhm.
you know, just taking a moment to acknowledge and appreciate how far we've come with medications and treatments, that I could still be
Yeah.
here and doing this podcast is wonderful. It really is.
Yeah. Agree.
So, your why when this started. Of course, losing somebody you love is so difficult. And, again, we talk about how lonely it can be to be sick. And it's hard to figure out where to go next because there's so much emotion associated. You've lost so much of your life as you once knew it. Maybe you've lost a career that you love. Maybe you lost a significant other. You've lost your freedom. You've definitely lost a life with it without anxiety because everybody has some level of anxiety associated with their
Mhm.
illness. And then on top of it, to lose somebody who was so close to you while you're going through this is difficult, and it could feel impossible. And you took that and looked at a way to move forward through this business, the Crohn's colitis dietitians, your podcast Gut Feelings. And I really relate to that because that's why I started living chronic. I did not know how to get out of that kind of grief, sadness, depression. I'd lost so much that meant something to me. And sometimes that grief is just overwhelming, especially if you've lost someone very important to you. So, and again, it's so difficult to make those choices and step forward, but finding a way to help others often is the way out. What was the moment you knew that this was your way to grieve and make it better?
Hmm. I think it was just this deep knowing that we deserve better.
Hmm.
And, a year after he passed away, I went through my own journey of like being in the hospital for a week and not having answers and going through that process. And also years later watching my mom go through breast cancer and how just seeing how messed up the medical system can be sometimes. Especially when I say medical system, I don't mean all the doctors and healthcare providers. I mean like the insurance companies and just
Yes.
seeing how just having so much anger about
Hmm.
that, having anger about that, and knowing that when you're dealing with the stuff that we're dealing with, just knowing that we deserve better. And
Yeah.
then getting to know what my patients go through and having to watch them fight for things and fight for medication that's life saving and,
Yeah.
you know, that kind of stuff. It just was like, it was like, how can you not? How can you not help? How can you be afraid at this point of
Hmm.
letting people in and being honest, knowing everything that's going on and knowing. I mean, I think that drove a lot of my interest and a lot of my research and a lot of my desire to learn about it. A
Hmm.
lot of it was very much, how do I help myself? How do I help other people that are dealing with it? And I think that's kind of what inspired that journey, was knowing we deserve better and wanting to know what that path looks like.
Yeah. Yeah. No, absolutely. We do deserve better. We really do. And I'm very hopeful, though. We have people like you out there, just fighting, helping people each and every day. We're out there talking about how to make things better. And, it goes back to that the I don't know is huge, but also, okay, we can't solve everything in a single meme, but we can do a lot by all of us
Yeah.
coming together and putting one foot in front of the other and fighting.
Yeah, I totally agree. And I guess the other gap that I saw in there's not a lot of people. There are not a lot of dietitians
Hmm.
specializing in IBD for
Right.
one.
Yeah.
The other thing that I have seen and experienced is the shame, I guess, that like when you think about like health and nutrition and how it's talked about online, there's this gap of like, sometimes it could come across as like shaming instead
Yeah.
of being
No.
helpful,
Yes.
kind of like,
Absolutely.
this is your fault,
Absolutely.
and it's
Absolutely.
not, and I think that's one other gap that I felt like needed to be filled, was like, hey, this isn't your fault,
Yeah.
but also it can still help and it can still be helpful. I feel like it's can either go in two camps. Like, it is your fault or it's not and there's nothing it can help with. And
Yes.
I think more so I'm in the camp of like, hey, this is not at all your fault. You did not sign up for it.
Mm,
But there is still a lot that we can focus on that we can help. So let's start there. There's stuff we don't know. There's stuff we do know. Let's focus on how can we get you to a better place? How can we help your meds work better?
that's
You
the
know, that's where I want to live. And I saw a big gap of like that's really what I think is missing. And I think we're
mhm.
thankfully we're starting to fill a lot of that gap, and I think we've been a part of doing that, and there's been other practices too that have done a good job of filling that gap. But yeah, that's, my message has always been like, this is not your fault, but also like let me give you the tools to help you
To
a little
help.
bit more so that you're not like struggling alone.
Yeah, yeah, it's so important. Again, I I know I'm not the only person. I know everybody out there with the IBD, or actually so many, I mean, everything really. The first thing, when you're getting really sick, the first thing they do is they put you on prednisone.
Oh gosh,
Healthy people
prednisone.
do not know prednisone the way we know prednisone. I'll hear
Yeah,
people say, "Oh, I was put on prednisone once for a sinus infection." Like
and they like it usually. Yeah.
you were not on prednisone. Like we're on prednisone. Okay,
Yeah, you
let's
like
start
it for
there.
2 weeks,
You
but
know,
you don't
this
like
little
it for
bitty
8 months.
this little bitty dose for so of course we get like the hefty dose, and so much that you have to taper off it for like
Oh,
1,000 years, and so you're really really sick, and then they throw you on prednisone, and I swear the more you take it, the more it affects you over the years. And now, when I first started taking it, I would feel a little bloated. And now, as soon as they give me that stuff, my face goes, "Chook, chook," I'm
uh-huh,
just completely
yeah.
round. I'm like, what happens? So then, of course, people are like, well, see, probably eating terrible. Look at you, And it's
Right.
like, wait a minute. Wait a minute. This is terrible. I don't like the prednisone, and now
Uh,
because I'm on the prednisone, it's my fault that
your
that I
blood
have to be on the
pressure.
prednisone. Like,
Yeah.
how are we spinning around here? I even had one person call me once, and she's like, "Well, what are you eating?" And of
Oh
course,
my
this person,
gosh.
she legitimately it does have an eating disorder. She is,
Mhm.
that's not me. That's her. But but she was kind of like, well, I only eat fish and chicken with no seasonings and no sauces and raw vegetables. So that's just what you need to go on. And I'm like, honey, you know what? I am very understanding of where you're at, but right now you might die. So please get off this phone. Because
Yeah.
no, it is not
Mm,
what I'm eating, trust me. So yeah, it's
mm.
so hard. People, it feels like this circular thing you can't get out of. And people are like, well, say it's what you're eating. You're like, but you just put me on the prednisone.
Yeah, I can remember a story when I was at in a doctor's office, and I had been on prednisone for 8 months, which is way
Yes.
longer than you're supposed to be on
Mm-hmm.
prednisone. Um, that was one case of my, like, treatment that I feel like went wrong, but I had trouble getting off of it and was having all kinds of, like, blood pressure spikes. And anyways, I was
Mm-hmm.
at the doctor's office 'cause I was having lots of, like, chronic UTIs from the prednisone, and I
Mm-hmm.
was just in a miserable spot, and they took my blood pressure, and it was elevated because I was on
Yeah.
prednisone for so long, and I could hear the doctor and the nurse talking outside, and the doctor or the nurse was like, "Hey, like, her blood pressure is high. Do we need to talk to her about her diet or her salt intake?" And then the doctor thankfully was like, "No, she's on prednisone, like, she's been on it for 8
Oh, we
months."
love you, doc.
Yeah, and I can remember thinking that and just being like, "Wow." Like, yeah, there's so much of a gap, I feel like, with just some of this little things like that that we go through that just the rest of the world isn't quite educated on yet,
No, and if for
but
some reason, I don't know the solution to this. Being somebody who has gone through so much over the last 5 years, I'm really unreasonable at times, frequently when I go into the doctor. I just am. I just am. I'm sick of it all. I'm like, at level 11 at all times, just freak, just angry, right? And, I feel like I need a cover sheet to, because I'm seeing a new doctor. They don't know what's going on. I'm like, you need to get it together. Do not start with me today. And I know that the medical community is in a bad place now. So I recognize that I'm being unreasonable, but I've gone through something similar. Now I know I have something called dysautonomia. And
Mm.
I've always
Mhm.
had very low blood pressure. It's very possible that this is something that could have been triggered that I've always had because, when I was in the army, I would, frankly pass out more than once if it was out, we were outside in the field and it was hot and humid. I'm like, woo, boom. And then it would, we'd find out I had very low blood pressure and everybody would yell at me that I wasn't eating enough salt.
Right.
Of course, now, if somebody told me in my late 40s, the doctor would tell me I need more salt, I would have told you were crazy. But I have dysautonomia and I do need to eat a lot of salt. But one of the things is that my blood pressure doesn't regulate. So
Mhm.
maybe I've been in the doc's office and you see I have very low blood pressure. They're always trying to keep me there to make sure I don't die. And I'm like, no, I'm fine. Let me go. I got some emergency salt if things go wrong. But then there's other times I go in and, I try to take the stairs because I'm scared of elevators. That's another issue. So I've walked up 8 flights of stairs. I've got a little something happening. My blood pressure spikes for no reason. And then I start getting a lecture about how high my blood pressure is. And that's just a
Wow.
really good start for a doctor to just about lose his head because it is not read the file, it's very difficult,
Yeah.
again, healthy people are reasonable people probably, and they're like, what is this lady talking about? Why are you screaming at doctors and nurses? But that is what we go through. It's like, it's not my fault. It's not my fault.
Mhm.
This is you. Um, so we've all been there. We've all been there. It's a tough life being us. Somebody needs to give a cover sheet to these doctors ASAP or whatever it is to say, do not ask about these 20 things because this is what she's going through.
Oh, yeah.
So yeah, every sick person out there was like, yes. So, you know what? Actually, I have one more question because I almost forgot. I wanted to ask you about this because the article came out today. And, as I've been going through this, I have learned nobody, again, Gen X stuff. Red wine's great for your heart. That's all I ever heard. And since I've become sick, particularly with a nervous system disorder, I keep hearing more and more about how bad alcohol is for us. And every neurologist is like, stop, stop, stop. It damages your nerves. It does bad things. And of course, today I read an article in the New York Times. The Surgeon General is suggesting that we put warnings on alcohol similar to tobacco, what we see on the cigarette boxes. So, what say you, the dietitian, especially the dietitian that focuses on IBD? What should we be thinking about all this, particularly with wine? Because I know so many of us love to have a glass of wine and we just don't care that we have Crohn's disease.
Yeah. I mean, I know that really well. Because when I was first, I think this is when I first diagnosed, I remember that was my way of coping.
Hmm.
Like,
Hmm.
yeah, and I was like, "Well, they do it in Europe, so,
If it's
it
Europe,
must
it
be
must be
good."
good.
Yeah. Yeah, so I would and this was in college, so I would have a glass, and then I'd be like, "Oh, I'll have to have another glass," and then it would just be every day,
Hmm.
and then I can remember going to a therapist and her asking me, "So you've been how long have you been an alcoholic?" And I was like, I'm not an alcoholic.
Never.
I just drink wine with dinner." She was like, "Well, you marked on there that you would have trouble stopping if we asked you to, and you also said that you do it every single day, 2 glasses a night or something like that." And I remember being shocked at that because
Hmm.
I had it's like the context you have to remember, like, the context they were in.
Hmm.
One, I think fairly safe to say, like, in America, I think alcohol has become really normal. It's a part
Yeah.
of that social aspect, especially in college setting, like, that's absolutely normal
Oh, yeah.
to be everyone around you to be doing that. But I kinda had lost that sense of, like, you just kind of you pick up on the cues around you, and I lost that sense of, like, where I was at
Yeah.
and didn't realize that I was using it to cope with my diagnosis and all of that. Um but all that to say, like, I think it's important to remember that, like, the context that we're in is that most people drink, and people with IBD, I would say less so. Less so, because just like everybody else, I've figured out, like, "Oh, I feel terrible
Yeah,
when I
that does
have
not
that."
make me feel good.
Yeah, but, yeah, I mean, kind of what we know about alcohol is, so we know we know that it's a carcinogen. Like, we do know that.
Mhm.
We know World Health Organization decided that a long time ago. We also know that if you're consuming it, 4 times a week, it increases your risk of what it does is it increases your permeability in the GI tract,
Mhm.
which can potentially increase risk of flare up. So it is
Yep.
one of those inflammatory triggers that can increase risk of flare up by about 400%,
Mhm.
which is significant. So if you're
Yes.
consuming a lot of it over time, then yeah, it's a concern from a risk factor perspective.
Mhm.
Now, like with any inflammatory trigger, it's always like dose dependent and how
Mhm.
often are you doing it. So I think it's
Yeah.
important to remember, like, hey, if we're talking like a wedding or special events, that's much different than how I was drinking it in the
Right.
beginning, or like if you're, but you do have to watch, like, when it comes to social gatherings, like if you're every Friday you're going out, and
Yes.
let's say you're just like giving into the moment, and you're drinking several. A lot of times people will say like, "Oh, I only drink once a week," and then we uncover it and it's like, "Oh, but you drank like 5 drinks that night,
Yeah.
and actually that wine glass was 2 or 3."
Yeah.
So, and so
Yeah.
it is important to kind of look at those things. It can be a trigger, unfortunately. Um, yeah.
I've talked about it a lot on this podcast, not because I'm preachy, but because I am just as bad as everybody else because it is a part of our culture. It's very much a part of our culture. I live in the DC area. The joke is that everybody here is a functioning alcoholic. We say it's a joke,
Wow.
but it's quite realistic. You finish work, you go to talk more work over drinks. You have drinks at lunch sometimes. There's an evening event, there's more drinks. You go to brunch on Sunday, there's bottomless mimosas. We're very much a town of
Mhm.
functioning alcoholics, if you want to be blunt. And of course, this country in general, I've talked a lot about, if you put yourself on Facebook and you have a photo of you finishing off the bottle of wine, nobody's going to say, "Oh, honey, are you okay? Do you need somebody to talk to?" They're going to say, "You go, girl, drink that mommy juice, open another bottle." So we just
Wow.
it's just
Hmm.
the culture. We don't talk about, well, that's not healthy. We're very supportive of
It's normalized.
drinking lots and lots of
Yeah.
alcohol. And when you become sick or have something happen to yourself, or you have to learn which up until I think this article, that really has for the large part been something you have to learn because you're a sick person, or something's happened to you. I Before a lot of this had happened to me, I had a lot of friends who had breast cancer, and each and every one of them quit drinking. I remember thinking, well, why quit drinking altogether? And they would say to me, well, it could cause breast cancer to come back. And I'm like, could it though? No, they're right.
Mhm.
It's just something the rest of us don't talk about. So that's why I try to talk about it as much as I can, just because we don't know. I'm not preachy. I'm terrible. I'm just as much a functioning alcoholic as everybody else in the DC, metro area. Although, now
Mhm.
I'm far more aware, and I, try to break the cycle of things that we view as normal that are not healthy. So that is why I try to talk about it a lot on this podcast.
Yeah, I mean, it's important to realize that it's very normalized. We don't think of it
No.
as addictive like drugs and stuff, but
Mm,
it
yeah.
is, especially if you're using it as a way to cope, like whether
Hmm.
that be with um coping with the social pressures, coping with your diagnosis. I mean, like for me, I was dealing with like trauma at the
Yeah.
time, and it was like a way of not dealing with it, and it
Hmm.
really was that escape button for me.
It is.
um in I avoided therapy for years, like using
Yeah.
that. But
Hmm.
but yeah, it is important to, I think, to, if you're someone who's like interested in finding some ways to mitigate the social pressures of it, there's so many non-alcoholic beverages
Yeah.
lately that are great. Like, a lot of them look like alcohol, even taste like alcohol, but just don't have that alcohol component to
Right.
them.
Yeah. In the younger generations, they know how bad alcohol is for you. They didn't, they weren't around in the 90s like I was when, we were told that red wine was just fabulous for you. Drink,
Yeah.
drink, drink.
they have a very different perspective, and they've done wonderful with, creating the various mocktails and different things. I know when I go into a restaurant now, uh, you know, I don't have to look at the cocktail list. I can go over and look at the mocktail list, or a lot of places around here have some really innovative lemonades that I always like. I love, some of their fresh made lemonades with the watermelon or whatever they're doing that day. So we do have options, which is wonderful. But yeah, we just, I talk about it as much as I can, just because it's not that we're all ignoring a problem. It's that most of us don't know it's a problem because it's so pervasive in our culture. And I always remind people, if you were putting a bottle of Jim Beam in your Facebook post and saying, should I go ahead and finish it off? People really would call and ask if you're okay.
Hmm.
They don't do it with the wine.
Mm-hmm.
So we need to
Mm-hmm.
have the conversation so that we understand the
Wow.
wine is not better than the Jim Beam.
Yeah. Yeah. That's interesting. I hadn't thought about that. That it's sort of seen very differently.
Yeah, it's fine.
Hmm.
Oh, mommy juice, have another bottle. But, we're hurting ourselves. And especially for women, 80% of all autoimmune disease sufferers are women.
Hmm.
And, we need to have these conversations because, we got to find a way to, get ourselves to be healthy. We need to find a way to keep ourselves working. So many of us are leaving the workforce. And, this kind of cultural phenomena of, the wine's okay isn't doing us any favors.
Yeah. And in therapy, I might
Yes,
add.
yes, 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 yes. Therapy, more therapy. Good gracious. Got to do better. So before we finish, quick, tell me a little bit about Gut Feelings, the podcast.
Yeah, gut feelings. We started. I think we're on our third year. This is our third season, and it's kind of real. It started off as kind of more real life conversations, getting really vulnerable, and in the last year, we started moving towards doing lots of interviews. So bringing a lot of guests on that I've always
Mhm.
wanted to have on, but we definitely sprinkle in some real conversations, nutrition education sometimes on there. So yeah, that's what that podcast is.
And all great information. The diet, I know everybody, we can't completely eliminate the Crohn's with diet or anything like that, but it is helping us to get better each and every day. It's so important to keep a good diet. Even if you don't have Crohn's disease, folks, a good diet will take you far. Um, if you're not here yet, trust me, when you get to your middle age, you'll start to see who took care of themselves and who didn't. It's very
Yeah,
apparent. It's very apparent.
yeah.
Well, thank you, Ashley, so much for coming on. This has been a wonderful, wonderful discussion. Everybody, please be sure to tune in to hear Gut Feelings with Ashley Hurst. Check out the Crohn's Colitis Dietitians. It's crohnsandcolitisdietitians.com. And also be sure to subscribe to Living Chronic. Thank you again, Ashley. This has been a wonderful, wonderful discussion.
Thanks.
Thank you so much for listening to this episode of Living Chronic. If you could please take a moment to rate and review and share this podcast, this is the best way to help this platform grow and create a community. In the meantime, you can follow along all the social platforms with the handle at Brandy Shantz on Blue Sky and X, and Chronically Brandy Shantz on Instagram and Threads. Don't forget to check out my website, brandyshantz.com. Have an amazing week and see you next time.